Here's my demonstration of shoulder dystocia. Blessica is sitting on the birth stool pushing, and I'm going to start where we start seeing head, and Amy is going to be my assistant who I'm calling out to, but you won't see an assistant. Okay, so we've been pushing on the birth stool. We started seeing head, and then so I'm encouraging slow pushing, nice, easy, push a little, breathe a little, and I have to help my baby as the pelvis. Okay, here comes their baby's head. Good job, almost there. Okay, so head is born, and then turtles. I noticed turtling. Let's put my vagina back around it, and okay, Blessica, I'm gonna need you to stop pushing. And Amy, I'm seeing some turtling. Can you prepare for that, please? And we have worked previously on what that means. She's going to get the recess and oxygen, everything close, make sure there's pit close in case there's a hemorrhage after, and have a phone ready to call 911 if we feel like that becomes necessary. So that's what Amy is doing right when I say that there's turtling. And then in the clinical scenario, you say that Blessica is kind of losing it a little bit, saying no more, no more. And I'm noticing that the head is darkening. So I'm gonna say, okay, Blessica, take a breath. Focus on my voice. You're going to be okay. I need you to do exactly what I say. Let's get you in hands and knees to help your baby come out. And so she's on the birth stool, so I would just have her come straight forward on hands and knees, and I would swing around to her other side, but for filming, we'll just switch her this way. Okay, don't push. Even if you have a contraction, I need to see what's going on. You're going to feel my hands, and I'm going to feel for a cord. Amy, why don't you go ahead and draw up that pit just in case we need it. And I'm not feeling a cord or a nuchal cord or a nuchal hand. So Bleska, that's really good. Let me feel, you're going to feel my hands going a little bit more. I need to see where your baby's shoulders and back are. And I'm feeling back on your left side. So Amy's going to help you get your left foot up into a lunge. Get your knee nice and close. Yep, just like that. Foot flat. Good job. Okay, with the next contraction, let's give a little push. Big push, actually. Okay, and I'm going to do slight traction just straight to see if baby's coming, and baby is not coming. And she's pushing, and the baby's not descending. I'm going to say, okay, Bleska, stop pushing again. Let me see if I can move your baby's shoulders. And I'm going to support the humerus, reach in where the arm is, and be behind the back. And if I need help, this hand is going to go in a little bit deeper, and we're going to rotate the baby into the oblique. And say, okay, with the next contraction, good, your baby's moving. Let's get another big push. And then again, I'm just going to do the straight traction to see if baby comes, and baby's still hung up. So I'm going to go back into this for this posterior arm. Bleska, I'm going back in the posterior for the posterior arm. I need to help your baby's arm. Don't push. And Amy, will you call EMS and get them on their way just in case we need them? You're doing great, Blessica. Just keep breathing. And I'm finding the elbow. Ooh, that arm is up there. I'm going to put pressure with my fingers in the elbow and get the arm to bend, and then reach with the other hand and bring that posterior arm. Okay, give me a big push now. I think your baby's coming. Good job. Straight, big push. Big, big, big. Good. And then we'll do a little rescue position. Make sure all the goop's out. Get baby to there. Mom's got her baby out. So yay. And then the assistant will immediately be checking on breathing and stimulating in cord, and and of course I will do my best too, what I can see. And monitor bleeding. If there's all of a sudden gush, I'll have her give the pit right away, and I'll take over with baby, and we'll situate ourselves in a way that mom is comfortable and we can work on baby at the same time. The other thing that we could do if the baby doesn't come is McRoberts, which, so after she's been on her hands, and you can go help her. Thank you. I can get her on her back and get her legs up and try that position to see if the pubic bone will go through. And then with the baby's back on the left like it was, right, left. The assist and baby still wasn't coming, we can do suprapubic pressure. I'll have the assistant above the pubic bone know to push towards the right to get those shoulders in the oblique and free. And if I'm unable to get my hands in at any point, I can cut a episiotomy so that I can get my hands in better. And then the other thing I forgot to mention earlier was for Amy to be keeping time, and that would be a predetermined thing when we have a dystocia. And actually, that's something I'm going to have my assistants do at every birth, is call out time after I say that the head is out, whether I say it's turtling or not. And then the other thing that can be helped is if baby's head is out and the shoulders are free from the inlet. Here, I should probably take this off a little bit. So if the shoulders do get past the inlet, but baby needs help. So say, okay, there. Get my shoulders are free. And then again, I can get mom on hands and knees or keep her on her back and do the pack pull, which is getting my fingers just underneath where the shoulders are, not in the shoulders, and wiggle and it's harder to do now that I left my assistant let go of my pelvis. Wiggle and jiggle the baby out. And then always preparing for resuscitation, bulb syringe, get the suction going, get the stimulation going, and then watching for hemorrhage. That's my shoulder dystocia. Hopefully the baby will be out in less than 5 minutes.